kick things off this morning with Jamie Jenkins, independent statistician and political commentator, of course, a man that used to work with the Office of National Statistics. Jamie, very good morning to you.
Good morning, Mike. How's freedom over there in England? We
Well,
still
I
haven't got
mean,
anything in Wales.
it's kind of feels slightly more free, but I don't think freedom was the wrong word to use, really, because I don't feel free. I can't go anywhere. I can't just jump on a plane and disappear off to France or go away to America if I want to go and see my family, so it doesn't really feel like freedom, but I guess compared to where you are in Wales, it's probably slightly more open.
Yeah, well, Wales, we're going to lift all restrictions, data permitting, on August the 7th. I think Scotland are in the right direction, but looking at where you guys are in England, I think you're right with the travel. I think one of my concerns with the travel policy has been there throughout, Mike, is more the fact that if people can't go abroad with all these costs of these PCR tests, and remember, we're testing over 1 million people a day at the moment. Majority of those tests are these lateral flow tests that the Americans have said are no good. The thing is, if you can't afford to holiday in this country because everything's booked up, if you're on low incomes, you can't afford to go on holiday, there's not much freedom in terms of going abroad and going about your daily lives at the moment, is there?
And people talk about, it's just a holiday, just deal with it. Well, no, it's not just a holiday. For an awful lot of people, it's the one chance they get to get away. It's the one chance they get to spend a decent amount of quality time with their kids. It's the one chance they have to have a bit of relaxation. And, if we can't get that, we're all going to go a bit mad, aren't we?
Well, that's one of the things of the pandemic, Mike, that we've talked about before as well, is this mental health crisis that's hit in the country, and in particular among younger people as well. So this offer of a hope of just, going away, getting away from it all is there. And I think the one concern that things start to creep up again now, Mike, which when it comes to these new variants that people talk about, worried about new variants, there's the beta variant now that seems to be coming in France and Spain. And in France, though, they seem to be having a policy where even if you're double jabbed, you still have to self-isolate, but they're not talking about bringing that in Spain. So in your intro there, you were talking about the government and all the conflicting decisions that are going on. It just seems carnage at the moment. And you'd think that with the country and the state that it's in at the moment, should the MPs or be going off recess? Should they be having a holiday themselves? Should they be getting back to work and showing some leading by example?
Well, exactly right. I mean, I dare say Boris will, even for him, try and avoid doing anything that might be considered to be a little bit sort of show-offy. Like, I mean, no trips to Mystique with Carrie, no trips to some it's expensive Italian villa in Tuscany. And I imagine he will be under pressure to vacation at home, staycation-wise. And I think any cabinet minister who goes abroad will probably get pelters from the public, won't they?
I'm sure they will, Mike. And if we just probably touch a little bit on what's going on with the numbers anyway, because I've heard that people are calling for further lockdowns in 4 or 5 weeks if things carry on as they are. One of the things that gets talked a lot about, Mike, though, is obviously England, the cases rising in England, cases rising in Wales. One thing that not talked about is Scotland, actually. So Scotland had higher cases in June than what they had at the height of the kind of the winter.
Well, Scotland was it not in June, the COVID capital of Europe, wasn't it?
It was the COVID capital of Europe. And one of the things that's gone on there now, Mike, the last 4 weeks is cases have come down, and they're coming down quite rapidly now. It's difficult to infer exactly why. Some people are saying it's because Scotland got knocked out of the Euros, but Wales got knocked out of the Euros, Mike. There was no effect on cases in Wales. I won't put it down to that. But one of the things that we do see is the schools close a month earlier in Scotland. So it could be that the schools closing has meant that one of the factors that can help spread the virus. We know that children don't generally get relatively ill anyway, hardly anything at all with children. And it could be that we start seeing the same effect across England and Wales. And we hit that cases of 50,000 per day a few weeks ago, but they're not really still going up dramatically. 20 to 24-year-olds have been driving the rising cases, Mike, but that's starting to dip back down. We're still not seeing the rising cases in older people. So I think Professor Ian Ferguson said it's a certainty we're going to get 100,000 cases a day. I'd be surprised looking at the data. It's a difficult one to predict, Mike, because we've never fully unlocked the country. Whether or not you could say, even with the restrictions being eased, we haven't really fully unlocked at the moment. I think, do we hit 100,000 a day? I'm not so sure. That's one of the things we look out for in the next few weeks.
I mean, despite this vaccine passport argument that was rather surprisingly hurled upon us on the briefing on Monday afternoon, up until that moment, it did seem to me as though the statisticians and the sage advisors and the medical guys had finally worked out that the cases actually don't matter as much as the deaths. And so they weren't drawing those same conclusions that they used to draw, saying, well, obviously, if the cases are still going up as fast as they are, then we're going to end up having to lock down again. It seems as though they've understood now that the vaccination program has meant that the numbers of people dying is pretty steady now.
Yeah, so people are talking about rising people in hospital. Remember now in January, if you look at all the beds, over 30% of them were full of COVID patients. But at the moment, it's just under 3%, 2.6 roughly for
Yeah.
general and acute beds. And then if you look at the cases, so when we had 50,000 cases back in the winter, it's normally that lag, Mike. So about 2 weeks after we saw 50,000 cases, we had over 1,000 deaths in across the UK. We're currently averaging around 36 a day. There's a big number yesterday, but
Yeah.
on a Tuesday, you sometimes get this lag over the weekend that's going on.
Yeah.
I'd be surprised if in 2 weeks' time we've even hit over 100. So deaths are down 90% from what they've got for the peak of the pandemic. The cases are definitely coming back. Will probably start coming back down over the coming months as well. So yeah, that link is clearly being broken. But I think the government, it's all the fear that's been put in the last year. People are still scared. Even if you're vaccinated, people are still scared to go out and do a lot of things. And that's what's kind of causing this kind of anxiety out there. The people are talking about COVID anxiety, Mike, because people are thinking, well, if I get COVID, I'm going to die. And unless you're like one of the severely elderly or people who've got underlying health conditions, this is a virus that doesn't hugely impact on them.
Yes, because
And
one
it
of the
takes
questions I always have, Jamie, and I don't know whether you can answer it, is of those 36 people that did die yesterday, or who were registered as having died yesterday, precisely how many of them were elderly, how many of them had underlying health conditions, how many of them were young, fit individuals? We sort of need to know that, don't we?
Yeah, so there is a bit of a lag between finding some of that out, Mike, but most of the deaths continue to be among elderly people. And remember, these are the deaths that are reported. These are deaths where there's been a positive COVID test. And you're never going to, once COVID's in society, Mike, you get a certain percentage of people dying every single day. And obviously, the older you are, the more likely you are to die. So we get deaths every single day. If COVID is there across society, people are going to die and test positive with COVID. The key thing is how many people are dying because of COVID. Numbers have been relatively low. And I'll tell you an interesting thing, mate. I was looking at the latest figures from the ONS yesterday. So they published the data up to the weekend in the 9th of July. And deaths now have started hitting that above average for the time of year again, where we talk about excess deaths. But this isn't all down to COVID. If you look at the number of deaths above average, it cannot be explained by COVID. We're starting to see rises in deaths for pneumonia and flu. And the key thing that's driving all of this, so since March, Mike, across the country, the number of deaths in hospital has been significantly lower than average than you would have expected. So it clearly shows people are probably still not going to hospital. And what these excess deaths are, and it'll take a while probably for the ONS to come out with the full underlying causes of all of these, is people dying at home. So the question for me is, are people still too scared to go to hospital and seek medical attention? Because throughout the pandemic, more and more people have been dying at home than what we saw pre-pandemic. And this is probably a national scandal about what's going on, Mike.
Yeah, it really is. And again, once we sort of move away from this nonsense of having to completely and utterly report every single death every single day, and I noticed the Telegraph this morning doesn't have their normal statistics on the front page, because that was quite useful for me when it would always show something in the area of about 1,500 people dying from all sorts of other reasons apart from COVID.
Yeah, so the majority of deaths, I think people keep thinking the majority of the deaths are people from COVID. At the peak of the wave 1 and the peak of the wave 2, it was still more people were dying of other things, but it was a significant contribution to the number of excess deaths. But deaths have been below average. I expect them to continue to go up over the next month. As cases go up, deaths will go up, hospitalizations will go up, but that vaccine has broken the link. And that's the most important thing. It's no point having a vaccination program and not getting the benefit from the vaccination program, because this time last year, people could go on holiday anywhere they wanted. And we hadn't even had anybody vaccinated. We didn't even have a vaccine this time last year, Mike. So you've got to realize that there's a benefit to a vaccine. And if you've had the vaccine, why are we still asking people to self-isolate? Why are we still not allowing people to go on holiday without all these PCR tests? Something needs to change.
I think you're absolutely right. Stay with us, Jamie. We're going to take a little short break. We're talking to Jamie Jenkins, independent statistician, of course, the man who knows all about the numbers and why they say certain things and why they reveal how things have changed since the beginning of this pandemic and since the beginning of this year as well. Welcome back to the Independent Republican Mike Graham right here on Talk Radio. Prime Minister's questions coming up a little bit later on, of course. We're talking to Jamie Jenkins right now, independent statistician, political commentator. The problem we're going to have, I suppose, Jamie, is as we move through the summer, and this is probably the last PMQs before that happens, August is going to be a big month for you in Wales. It'll also supposedly be the time when some of this self-isolating nonsense gets put to bed, doesn't it? And people who have been double jabbed won't be self-isolating, because we've still got a problem with this app, haven't we?
Well, we've got a massive problem with the app. Some people would say the app's doing the job that it's supposed to do. It tells people if you've been in close contact with somebody. But I think for me, where the problem with the app now is, Mike, that you can't have a policy where a Freedom Day, for example, happens where you allow people to go about living their daily lives where we go into live with the virus. Cases are going up because we inevitably, even Patrick Vallance and Chris Whitty have talked about an exit way when you unlock, cases will go up. And then you start pinging everybody who's basically been in close contact. And sometimes, Mike, it could be that I think the stories have been you could be living next door to somebody, you've been pinged through the wall. So you can't have a policy where you've got to isolate where you've been coming into close contact, because ultimately the economy is just going to close down. And we're seeing lorry drivers are self-isolating, so supermarket shelves might be closed, factory lines are going to be kind of closed down. And they're changing the rules now, Mike, as well for NHS staff, because I know people work in the NHS and they're saying that they can't get enough staff because people are self-isolating. And the rule changes here is that you can take these tests and go into work every day. But the thing for me on this is we've talked in the past about the fact that hospitals are one of the most deadly places to catch COVID, and a lot of people have gone into hospital without COVID and are caught in there. So if it's good enough for NHS staff to be able to go about doing some daily testing to continue to work and go about their daily lives, why isn't the rest of the population able to do that where they're not coming into close contact with ill people?
Yeah.
So,
well, it obviously doesn't work on various levels, because on the one hand, you've either got people switching the app off anyway. Secondly, you've got people who are supposed to self-isolate but not bothering to do that. And thirdly, if you are self-isolating without really needing to, it's a drain on the economy.
Exactly that, Mike. And remember now, the app, it doesn't mean that you have to self-isolate. If you're contacted by a contact tracer, there is a legal requirement to do that. If you get pinged by the app, there's no legal requirement. It's more guidance, and more people are knocking the app off. And I think as we go into the coming months, Mike, I think I was just looking at the latest data for Boris's approval rating, which has gone down. He had that vaccine bounce, and I think the vaccine passport's starting to see his approval rating going down now, I think, over the country. And Keir Starmer's less than that. What's intriguing for me with the whole vaccine passport debacle as well, Mike, is in Wales, normally Mark Drakeford's kind of the person who wants all of the restrictions that he can put in. He's come out last week and issued a statement again saying it's not the role of government to implement vaccine passports. So you could have this vaccine tourism where people think, well, if I want to go clubbing, I don't want to show a vaccine passport, I'll pop over to Wales or something.
Off to Carmarthen. Well, you never know. But people just, I think, are not going to be seeing this happening. My view is that this is a bit of a red herring that Boris Johnson's thrown out there, because they do seem obsessed with getting more and more people vaccinated, despite the fact that some of those people might not want to get vaccinated. And I wonder whether this is just a kind of a ruse to try and warn people that if you don't get vaccinated, you won't be able to do anything, and then see how that goes.
I'm in the same camp as you with this one, Mike, because remember many, many months ago, they were saying that, we're never going to introduce vaccine passports. They've probably had some meetings in the department and thought, well, how are we going to get the vaccination rates up for younger people?
Yeah.
Well, if we put this one out, the word on the street will be, you need to get your vaccine to go out. Now, obviously, let's look at the vaccine itself. So Sajid Javid is a good example. What Sajid Javid proves is that the vaccine doesn't stop you getting the virus, even if you are double jabbed. What the science behind it all, Mike, is that if you've had a vaccine, it'll reduce the viral load and stop you spreading it. But remember, the younger people we're talking about here now, the flu is deadly. We see the flu killing many people across the country every single year. And we don't actually mandate vaccinations for people with the flu. We also don't mandate vaccination passports for people with the flu either.
No.
So whilst there's the benefit of having the vaccine reduces the younger people are, and that's why the government have come out this week, Mike, and said they're not going to vaccinate all children. So I think having this threat of vaccine passports under the kind of the guise of if you can't go clubbing, you can't go into events, are people going to be able to go on the tube, because that's going to be an enclosed space by the end of September?
Well, I mean,
I'm with you. I can imagine it's more of a coercion tactic.
Yeah.
Whether or not it will actually happen is another thing.
Yeah, I think so, yeah. Absolutely right. Jamie, thanks very much indeed. Jamie Jenkins, independent statistician and political commentator, of course, there on the subject of where we are now, which is kind of nowhere again. It feels like we're nowhere, doesn't it? We're not in a free state. We are not in a lockdown state. We're not really anywhere. We're sort of somewhere in between. Do you know what I'm saying? 03